Now, let's turn our attention back to vaccinations, shall we? Limpopo is leading the pack with over 66% of over 60-year-olds registered for vaccinations. That's compared to 37% in Gauteng, 47% in the Western Cape, and the Eastern Cape and KZN at 45% respectively. Well, it's always good to speak to Limpopo Health MEC, Dr. Phophi Ramathuba, joining us to tell us what you're doing differently, Dr. Ramathuba. Good morning. So, COVID vaccination registrations, different, of course, to the actual vaccinations. We'll talk about that now, but the vaccination registration drive going very well. Doctor, tell South Africa, what are you doing right?
Morning, and morning to all your viewers out there, and thank you for giving us this opportunity. As a province, we usually, when we are given a task by national, put up a lot of effort on the planning. The reason is because we know our material conditions are completely different from other provinces that you have mentioned, which are mostly have got their own metros and they are in urban areas. We are predominantly rural. And then, of course, when we were given a task to register the senior citizen, we knew firstly that our areas have got challenges in terms of network connectivity. We knew this category of the senior citizen, the above 60, do not understand probably or are familiar with internet or issues of Wi-Fi or what is supposed to happen, just the basic of understanding. And of course, we also knew that they don't even have the smart cell phones, the gadgets that are required. That is why we put up 3 stages of registration. The first one is the one that was launched by the Minister of Health, wherein everyone was self-registering. That one we did not rely on because we knew it could only be used by those who are in the urban areas. The second stage that we also launched ourselves, which was launched by the Premier of the province, was when we were assisting senior citizens on how to register and therefore activate all our facilities, whether it's a clinic or a health center, to say if a senior person come, assist them to register. The third one, which I think is the one that has worked for us, was to say to all our community healthcare workers, which are more than, I think, around 9,000, wherein we had given them, allocated them those smart gadgets, the Android phones, and also we loaded them with data, and they were then deployed to do door-to-door. Because these are the cadres who currently, and even prior COVID, we've been using them to do door-to-door on TB screening, HIV and AIDS. They are home-based carers. They've been supporting patients who are sick, helping them to collect medication in the clinic. So they know the environment, they know the villages, they know their wards. So they've been going around registering senior citizens and making sure that when the times to launch the phase 2, which was 17th of May, senior citizens are ready. Now, coming to the issue of vaccination, we also knew that our people have got strong belief in our own churches, in our own bishops. We also know that we do believe in our own traditional leaders. So we must appreciate the role that has been played by those leadership. We know our people have got so much confidence in them that they even do to have, that they have to us as politicians and even to the health professionals themselves. They don't even trust their doctors more than they would trust to their leadership. So that is why, in partnership with the leadership, we have been able to put the drive on registration and vaccination.
So that looks like it's a case of early education, it's technology adoption, Dr. Ramathuba, and also the churches getting involved as well. I'd like to find out, because as we talk about Limpopo, it's not just the technology gap as well because of rural areas, the physical distances between some of the villages, between some of the rural areas, very far away from central built-up areas. Just talk to me briefly, if you could, Doctor, in the last minute or two I have with you, the logistics on the ground as to how you're able to mobilize, I think you called them community service workers, to go from door to door. Perhaps that's something the other provinces need to look at. That's a lot of manpower.
I didn't get that question clear. There's been, I think, network challenge.
Okay, let me try again, Dr. Ramathuba. What I'm asking is, as far as the community service workers going door to door, how efficient has that been, considering the distances between villages, rural areas and the built-up areas? Can you talk about the volunteers going door to door? Because that seems to be what's making the difference here.
You know, like I've indicated, these are the cadres who knows these areas. They are not starting now with the registration. If you remember last year when the president launched the mass household screening campaign, as Limpopo, if you go back to those figures, you will realize that the number of people that were screened in Limpopo were more than many provinces combined. And the reason is because we use the similar strategy. The community healthcare workers, we provide them with transport because they know this area. They will tell you that between this village and that village, I would require transport. So our municipalities in certain area, I must also thank them, especially some of the ward councillors. We do have very progressive ward councillors in our province, wherein even during the screening, what they will do, they will use their own buggies, their own vehicles to assist them to be able to reach out to even those areas that they couldn't reach out. Because what we usually do is that we use our own transport. In the morning, we pick up our community healthcare workers from the clinic and we go and drop them off in their own different villages. They will register in the village and then come back. Now, the other thing is that we work smart. Smart in the sense that each community healthcare worker is assigned his or her own number of households. You are told that you are given 160 households for you to work on, because we have done the analysis in terms of how many households we have in the province, which they are around 1.6 million. So already these community health workers knows within their household from the screening last year, they know how many households do we have and how many elderly people in each household. So they
understand not just the area they're working in, they understand the households and the people that they're dealing with as well. And I think that seems to be the big difference, especially in Limpopo. Health MEC, Dr. Phophi Ramathuba, a pleasure speaking to you. And thanks for your time in speaking to us here on ENCA. And I think the churches, the community workers, and going house to house. Now, it's obviously, I think, a bit unfair to compare Limpopo to, say, Gauteng, the Western Cape. But I think the comparison between 66% of people over 60 registered in Limpopo, the more direct comparison, I think, from the rural perspective, is then the 45% in the Eastern Cape and KZN with 45.
Right.
And I can't help but think these the household door-to-door visits and the churches
played a role
there. Maybe KZN and Eastern Cape needs to look at something like that.
And just for clarity's sake, these are registrations, right? These are not actual senior citizens that have been vaccinated.
Not as yet. It's the registration drive
process,
to get them going.